Hi, I'm Jennifer Sauvier. Welcome to another webinar for Grow Dental Education. We're so happy to have you with us today. The topic is going to be Hipaa, and that is not necessarily a enjoyable, exciting topic, but we're going to do the best we can because it is a compliance issue. So how can we work within the regulations that we're given and give the best protection to our patients? Hipaa stands for the Health Insurance Portability and Accountability Act. It's always been part of our code of ethics to really protect the information that we're given, both health and personal, that we receive from our patients. Hipaa just makes it a federal duty to do so. So we're going to outline what those requirements are that we receive from the government. What are we talking about today? We're talking about what's commonly referred to as PHI, Protected Health Information. And that's what really Hipaa boils down to. It protects all information, electronic, written, spoken, that ties an individual patient and his health care to your office. Now, if you want to get technical, there are about 18 identifiers that are considered PHI. Things that we could put in that list would be social security numbers, birthdays, obviously names, license plate numbers, things that we traditionally think of and that we try to protect. Say if we have a piece of paper, that's how we decide to shred it. In the office setting for internal use, we have much more leeway than we do for external use. But still there we have need when we're talking to referring offices per se. So that's the information. Anything that would attach that particular individual or their health care to our office, whether it's one piece of information, one identifier, or whether it's multiple, that's what we're given the duty to protect. There are required disclosures. The main required disclosure is the patient. The patient has every right to see their chart and see not only the chart, but obtain a copy of it, either in paper form or electronic. And then the Department of Health and Human Services also has the legal right to that information if they request it as well. As far as permitted disclosures go, if with the patient's authorization, if we're given their authorization for a particular piece of information to be used in a particular way and for a particular time period, that is also allowable in special circumstances. Hipaa can be divided into two distinct regulations for simplicity's sake. The first is the privacy rule and the second is the security rule. So we're going to break these two down, and you'll see similarities, but it will help understanding them and being more user-friendly. So let's start first with the privacy rule. When you have a regulation or the privacy regulation, first thing we need to do is assign a privacy officer. And we are simply looking at information that we have within the office that's PHI, and how do we keep that use going and not diminishing the care of that patient without giving it out when it's not crucial to have. So the privacy officer will start out with looking at the office and processes in the office and auditing them, then making the policies and procedures for the office, documenting them, and then doing random audits to make sure that with time we haven't backslid in keeping that information private. They are responsible for developing, auditing, updating, as well as employee training. Hipaa is a little different than OSHA. OSHA requires an annual meeting that covers X, Y, and Z topics. Hipaa just states that training needs to be done and documented. Remember, documentation is really important. Documented when an employee starts, when an employee changes duties that will affect the information that they are using on a day-to-day basis. As well as with time, it's always a good idea to bring it up into the consciousness again and do a little review, because if we don't use it, we lose it. So that's not a specific time period, but make sure that every once in a while you have a small Hipaa meeting and you document that. Another part of the regulation are the forms that we use, and there are 3 basic forms. The first is your copy of Notice of Privacy Practices. So that's that 8.5 by 11 sheet of paper, probably front and back, really small print, that we give out to our patients, and we say, this is our notice of the practices that we use to keep your information private here in the office. And if you ever have a question as to what's allowable and what's not, that's your go-to place. That's pretty much your contract between your office and that patient, how you will use their information. For lack of a better example, that's your Bible, so to speak. And most of us, honestly, don't sit down as employees or a lot of times administration and read through that notice. But be familiar with it. When you're down one day and things are a little bit slower, pull it out and just familiarize yourself with it. That will give you all the answers you need and answer questions that may be in your mind. What you will find on that notice are permitted uses. Permitted uses are treatment, payment, and healthcare operations. It's given to the patient on their first visit. We post a copy in the office, and that's required. Then, with technology and websites that we're adding to our practice, it also needs to go on the website. So that's a newer addendum. When we update the notice, and at the end we'll go over some updates that are fairly new that you may want to add into your notice of privacy practices. When you update that, you don't need to do a mass emailing and send it to all your patients. You can simply just have them sign a new acknowledgement when they come in for their next visit. And of course, if you have a new patient that comes in. So that brings us to the second form, the acknowledgement of receipt. That can be a document in itself, a separate piece of paper, or that can be in with some of your other consent forms that you have in the chart. All they're signing is that, yes, you gave me a notice of privacy practices and I received it. And it's nothing more than a signature. The third form is authorization. So what if you want to use information outside of that notice of privacy practices and your patient is okay with it? For example, maybe you want to use them for some marketing purposes, or maybe you would like to use their photograph to show a before and after. That's where an authorization form comes in. It gives the specific item that you're going to use, how you're going to use it, and the time period within which you have to use it. So it's a contract between you and that patient. So anything outside of your notices goes into that authorization form. So what kind of information does that notice of privacy practices really allow us to use, and how does it allow us to use it? There are 3 ways. The first is treatment. So when we're actively in the treating process of that patient, we can use whatever information we need to get that treatment done. That can also include a third party or a referring dentist or referring specialist. So that is covered under the treatment section. The second section is payment. So we can use that information if we're pre-qualifying an individual, if we're working with their insurance, if we're billing. All of that comes under the second item of payment. So that too is acceptable. The third are healthcare operations. So let's say you have a quality improvement program, or you're doing some in-office training and need to use PHI to do that, or you're auditing charts. That is just the general business that goes on day to day in the office. So that's the third area. So again, we have treatment, payment, and healthcare operations. Those are all allowed under your notice of privacy practices. If there's something beyond that, then we create an an authorization form where we can use whatever the patient and we agree to. So we discussed the privacy regulations. Now let's look at the security regulations, the other side of that coin. Security regulations, too, require that someone be appointed and responsible. So that is your security officer. Now, most of us in the office wear multiple hats. And even though we need a designated privacy officer and a designated security officer, they can be the same person as long as they're documented and carry that title. So what does a security officer do, and what does the security officer rule deal with? How it's different from privacy is that it really focuses on how you physically secure that information, and it does so much with electronic PHI, so the computer side, the IT side of our practice. So the security officer will do essentially what the privacy officer does: look at your office, analyze risk, analyze vulnerabilities, and see where you need to beef up a little bit, create those rules and regulations that you go by in your office and document them. And then every once in a while go through and make sure we're still as secure as we can be. But let me give you some ideas of areas that you want to look at when you're going through your office and you're doing that audit. It can be as simple as, is the building secure? You know, how you go about securing your office in the evening. More technical, you want to look at your network. If you have a server on site, is it locked? Who has access to the network? Who has full access to the network? For example, administration. So we can have different levels of security here. You don't want to allow access beyond what the job duty requires. So you may have one level of access that is open to everything. You may have 2 or 3 levels depending on the need and job responsibilities of your teammates. Going along with that comes username and password. So you can verify who is in what information and do audit trails if need be. Do you have a backup procedure? And in the event of an emergency, who's responsible for restoring that data and getting that rallied back in and safe again? Email needs to be encrypted. That is email that contains PHI. So if it's an email, a friendly email of just simply communication, it does not. But if it contains patient PHI, it is required. And that is concerning, possibly, if you're not an IT person by nature. But the ADA even recommends some software that is simple to use and even free in some cases. So that's a great resource to go to see how to get your information encrypted if it's not already. And lastly, maintenance records. If you have a piece of equipment that needs work done to it, it's simply a log, the piece of equipment that was worked on, the date it was worked on, and what was done with it. So you can verify who's been with your information and at what time if you ever have an issue. Another good idea to have is to take a clipboard and a piece of paper and a pen and go through your office and log every piece of electronic equipment you have along with the serial number. It's kind of like a credit card, having that information back home so you can validate that if need be. Who is the enforcing agency for Hipaa? That is the U.S. Department of Health and Human Services. They rely on whistleblowers to follow up on instances where information is being leaked. So as a risk manager, looking at administration from that angle, it's nice to throw that into your exit interview. Ask them, is there anything in our policies and procedures that concerns you? And if they state no, and then later come back with a different answer that will question credibility. Hipaa, though, the U.S. Department of Health and Human Services has grown because the risk is growing with this information age. So it used to be that they solely relied on whistleblowers. That's not the case anymore. They're becoming like some of the other government agencies such as OSHA or CDC. They can come in and do an unannounced audit. And so you want to have your HIPAA binder with your policies and procedures together, and you want to have your documentation caught up in the event that that were to happen. For violations, they also are growing. They used to be much smaller than they are now, so I'm just going to read this to you. The annual cap is $1.5 million for all violations of the same requirement. If a violation was willful neglect and not corrected in 30 days, a minimum penalty of $50,000 per violation. So the numbers can get quite large. However, it is within the realm of scalability. So a small practice is not going to accrue the type of violations that a large organization or a large company could, just because of the amount of information that's coming in and out. So we've discussed the privacy regulations and the security regulations, the two main branches of HIPAA. Now let's look at the people involved. We're going to divide them into the individual or the patient, look at it from an administrative angle, and then look at it as a team member, and knowing how we need to think and how we need to look at our office and uphold those regulations as a team member. So first of all, we're going to start with the individual or the patient and looking at their rights. They first have a right to all of their records, and if they request a copy of that, it can be either submitted to them in paper form or in electronic form, and we have 30 days which to provide that to them. You can, if you so choose, add a small cost for duplicating that information and mailing that to them, but remember, it needs to be small if you decide to do so. They also have the right to, while they're examining their records, to make an amendment. If there's something in there that they don't agree with, they have the right to request to make an amendment. If that's done, you want to keep a copy of the request. You want to keep documentation as whether you decided to do that or not, and the reason for your decision. If you decide to allow that, it needs to be a separate entry and referring to the entry that was of concern for them. But keep it a separate entry and keep that request as part of their file as well. Accounting disclosures. If outside of treatment, billing, and healthcare operations that we're allowed to use that information, if they've given us authorization for something specific, then we keep a record when we used it, where it was sent, and who obtained it. And they have a right to request that log as well. And then complaints. And this is something that HIPAA wants to make sure that we have in motion. If someone has a complaint, who are they to go to? So you need a person's name that's familiar with the rules and regs. And then what do you do with that information once you received it? You don't have to report it to the Department of Health and Human Services, especially if it's a small nature, but have a spot where you can record what was requested of you and what you did about it, and in good faith, that will keep you covered. So that's a good segue into administrative requirements. So if you are the privacy officer or the security officer or your administrator of your practice, what does this really mean, bottom line, for our office? First, we want to have our policies and procedures documented and in a format that's easily accessible. If we were to be visited and audited, we could get that out in a quick manner. We want to have a designated privacy official a designated security official. And again, that can be the same person. The third person that we want to have designated is the person that will receive complaints. And all three of those people can be one person in your office. You want to have your physical safeguards in place, the things that we just discussed on the security side. Your training, and every time you do training, make sure it's documented. Just like in the healthcare chart, if it wasn't documented, it wasn't done. So anything you do with Hipaa, make sure and keep a record of it. The complaint process, they want to know what your complaint process is, and again, documentation for that. Another piece that they want to see is for sanctions and violations. So let's say that you have an employee who fails to comply. They want to see a policy that clearly states what you will do. It could be as simple as first violation, you talk with that individual. Second violation, a written notice. Maybe third time, administrative leave without pay. And fourth time, termination. You decide what that is, but make sure it's part of your policies and procedures. We are to restrain ourselves, I should say, from retaliatory acts. So if we have a patient or an employee, either one, that complains, we take that information, but we can't retaliate against that individual. And then lastly, business associate agreements. We may have outside vendors or third parties that we use that come into our office. For example, maybe a janitorial service or an IT company or an accountant. They have access to information that is deemed PHI. And so what can we do to safeguard ourselves? Simply a business agreement. And if they're used to dealing with anyone in the healthcare industry, they should be familiar with your request of asking them to sign off. And what they're stating is that they will treat your patient's PHI with as much security and good faith as you do. And have one on anyone that you have business with that can get to PHI. Lastly, dental team responsibilities. So this is really where the rubber meets the road, as they say. How do we really live this as far as Hipaa regulations? First of all, just think of yourself, pretend that you're a patient coming into your office. I come to the front desk. What information do I see? What information do I hear that could be considered confidential, that's about another patient? As I walk down the hall, some of us are electronic, some of us still rely on paper. Is there anything I'm going to see? Do I have a printed schedule out? Do I have a screen that doesn't have a username and password to access, that's just open? When I'm seated in the dental chair and my coworkers and I are discussing a patient, which is part of the treatment and part of the requirements in our organization, can I overhear that? So just be really mindful. When it comes down to it, it's common sense. What can I see? What can I hear as a patient? And then if I'm thinking about it from a team member angle, you know, what can I do to really keep those things private and just focus solely on the patient that's with me at the moment? I'm going to give you two stories because it's something that we don't necessarily think about. I think we're all really conscious about keeping things private for our patients. But here are two examples of things that we might do unknowingly that is a breach for PHI. The first is a lady who went into a dental office with her husband, and she was family member waiting out in the reception area while her husband was being taken care of. And as she sat there, she was overhearing the receptionist, which again, a lot of times we wear multiple hats, calling in insurance companies and stating patient names, birthdays, social security numbers, and the list goes on. As she was sitting there, she started tallying these up. And when her husband was ready to leave, she took her piece of paper up and she said, "I'm not going to complain. I just wanted to let you know what I heard while I was sitting out in your lobby." So voices travel. Just be mindful of who's around. And we can't guarantee that we will never have a breach of information in the office. It's not practical, but in good faith, we do the best we can. Another example is talking to coworkers outside of the office or family members. Sometimes we need to decompress, and in the evening, we just need to talk about our day to let it be. This occurred in a restaurant, and this was local where we are, and it was from a hospital setting, but it proves a point. Coworkers were out to lunch, eating together, and they were in a big booth, and behind them was another family that was seated. Now, the staff from the hospital were really conscientious not to use the patient's name, but they were talking about this patient they had and the problems that they were having with them. And it was enough information, and again, this is ironic, but it does happen. That patient that they were talking about was the family member of the family behind them. And they were able to piece enough information together that they knew that that was their family member. Again, it wasn't intentional, but just be mindful. Sometimes it's not one piece of information, but it's 2 or 3 or 4 that we put together, someone overhears, and it can be considered a breach. So just be mindful about conversations both inside and outside the office, even at times when they're casual. We have to use our best judgment to reduce risk. We can't guarantee that that will never occur, but so much of this is common sense, so make sure we use it. Lastly, our computer systems. We have our username and password, and screensavers are a good idea as well. So if we get up and leave, we log out, or at the least, a screensaver goes on to protect that information from eyes that might be passing by. So HIPAA is something that we've lived with for many years, and we get used to those rules and regulations, and it's good to refresh on them. But something we're going to add on to the end here is even probably more applicable are updates, because new acts come out, new regulations come out from time to time. And so we're just going to review those right here and get a little refresher on them as well and make sure we're compliant. One of which was just this year of 2013 in September. So this is very new information. The first is the High-Tech Act, which has been around for a couple of years, but it's still considered an update. And it has to do with a breach notification rule. So let's say you had a breach of information. Now we're required to do something about it and to make appropriate notifications. What are those? Well, it depends on the breach. If it's something that has a low probability of compromise, for example, we faxed some patient information to a wrong provider. We were referring and it went to the wrong location, and we get a phone call or we get a fax back, we receive this. The probability of any breach occurring is low because we have trust there. We know that referral, it was on one patient. We're not overly concerned. So that's a low probability. The Breach Identification Act is interested in higher probability. So let's say we received a virus on our computer system, or we inadvertently sent out an email with multiple patients to the wrong address, something of that nature. If it involved more than 500 people, we're required to notify those individuals as well as notify the Department of Health and Human Services immediately. If it was less than 500 people, we're still required to notify those individuals, but our report to the Department of Health and Human Services can be an annual report within the year. So we're back to just using common sense. If it was a very small issue involving one person to someone that we feel the information's safe with, that can die there and we can learn from it. But if it's on a larger scale, then we need to have a plan as to what we would do about it. And that is another little addition to add on to your notice of privacy practices. So when you update that, slip that in about a breach notification rule and what you will do for your patients in that case. Now we come to the omnibus rule, which just went into effect the end of September 2013. And that basically boils down to updating your notice of privacy practices. Things, blurbs that we need to add on to that notice to be compliant. There are great websites and resources out there that if you want wording for these additions, they're available. In fact, there are even notice of privacy practices that have been updated that you can get specifically for dental practices. So you're not on your own, just make sure they're updated. But here's a list of the updates that are now required to go onto that notice. The first is fundraising. If you use PHI for fundraising or not, you need to state that and then give your patient an option to opt out if they don't want to receive that information. If you use PHI for marketing or sales purposes, that you will get a written authorization from your patient prior. So that's another item to add. The third is the breach, PHI breach, that you will notify your patient in the event that something happens. The fourth is that if your patient decides to pay wholly out of pocket, then they have the option to ask you not to report that on to their healthcare insurer. Much like if you had a small fender bender and didn't want to report it to your insurance company and you just handled it out of pocket. The next one has to do with the patient's right to an electronic copy of their healthcare record. So they've always had the right to a copy. Now they have a right to it in electronic format if they decide to. Again, that's just a blurb. All of these are just blurbs to add on to your notice. Then the effective date of your new notice, and then the notice must be posted on your website. So as a whole, for the omnibus rule, it just has to do with your notice of privacy practices, to add those points in to your privacy practice, either to the form you have or to update your form and start using it. And remember, don't make it a bigger deal than it needs to be. Simply just update it when a patient comes in next time for a visit or if you have a new patient. And make sure and keep that old notice that you've just taken out of use for at least 7 years. So if anything happens, you can pull that and show how you used PHI for that prior 7 years. So those are the updates, both the HITECH Act and the Omnibus Rule. Even though we consider that notice of privacy practices our Bible, that's what we run on, sometimes we get ourselves into situations and we're not quite sure how to handle it. So I've compiled 4 different questions that we commonly get just from other offices and see what answer we might give. So the first one, if a patient refuses to sign the acknowledgement, can I refuse treatment? Well, it's your obligation to show them the notice of privacy practices. If they refuse to sign the acknowledgement letter, you simply make note of that. That's not a basis for which you can refuse treatment. You, in good faith, offered it to them, so simply note that in the chart and be on your way with your true patient care. Another question, how specific can I be with messages on answering machines and reminder cards? Well, HIPAA's intent is to promote privacy. We understand that. But at the same time, without impeding patient care. So when HIPAA first came out, we got a little crazy, if you will. And sometimes we got to the point we were so closed-mouthed and had our documents so tight that it was even impeding care for our patient, which missed the whole point. So we can remind patients of their appointments. We can leave a message. We just want to do the minimum necessary. So maybe something like the person at this household, or their name if you decide has an appointment, blah, blah, blah. Or if you have information to leave them, just leave them a message to call your office. The minimum necessary to take care of that patient. Here's another idea you might consider. On that acknowledgement of notice of privacy and practices, it's a fairly small statement, and that's why you're given the opportunity to either have that as one sheet of paper or add that into other consents and forms that you may file in your chart. Here's something you might consider adding it with, which ran across and I thought it was a good idea. Ask that patient right there on that form, can we leave a message? Can we leave a voicemail for you or on your answering machine regarding your appointments and regarding follow-up, and just have them check yes or no. And another thing that I've seen is what individuals can we talk to, and have them list that out. So that way you know that you're fulfilling their issues and you're keeping their information private, but you're still giving them good care. Again, that's just a side idea that I've seen used, but it works really effectively. Third question, what if another person is responsible for paying the patient's bill? How much information can I disclose to them? Well, remember, the notice really allows us to work within 3 areas. One is treatment, one is payment, and so if a person is responsible for paying the bill, then we can give them information pertaining to that bill, and enough to do so, enough for them to make decisions. Now, it doesn't have to get into the treatment and care of that patient. If they're responsible for the bill, then they can have access to billing information. But it's a good idea to understand what your patient's desires are. And again, that's another great use of that little check-off sheet as a communication tool. But if they are responsible for the bill, then they have access to it. Another question, the 4th one, do I have to give a patient copies of his records if the patient is delinquent on their office bill? Well, we would like to say no, but the reality is that is their chart, and they have every right to accessing it, whether or not they've paid their bill. We can't hold the chart ransom to get payment. So I hope that answers your questions. The information that is available for you to download with this webinar will give reference material and resources and some bulleted points so that you can have something to refer back to. And if you want to get in depth and research further, that will allow you to do so as well. So we just want to thank you for spending another time period with us and enjoying another webinar, and we look forward to getting together for another topic. Thank you.